there. Share. Uh-oh.
You hear that? That's a branch outside screaming.
I thought you were doing it. I thought it was, I'm like, where's that noise coming from? Coco. Monitor.
Hi guys. This is Nurse Val. I'm Nurse Maddie. How are you guys? I'm so excited you guys are here. We've been trying to get this kid out for hours. Yeah. Yeah, it has been. We just needs to go.
So go ahead and give him a report. I'm precepting her. And
Yeah, it's like my second day. So this is Johnny Ringo. He's 5. He came in a couple hours ago. His dad brought him in because he just hasn't been feeling well for the last like 3 weeks or so. For like flu-like symptoms, his dad says some nausea, vomiting, some bedwetting, right? And we've done some things to him. We gave him originally his blood sugar was 800, and his original K was 5.5. We've given him 8 units of insulin in some bolus, right? And then we give him 500 mLs of saline. But that's really about it. Yeah.
we did repeat the last.
We did. Last blood sugar was 250. The last K was 3.5. This is my prescription. So.
I mean, I don't even know what the hell she's wearing. So
That's a hell of a thing to say to me.
Listen, who does that?
This is a proper nursing uniform. This is Johnny.
Johnny.
Yep.
Johnny Ringo.
Yep.
Ellie's.
Yeah, Johnny's been pretty tired. We were just letting him sleep since we've been waiting for you guys. We've been waiting for quite a few hours. So we just thought he was really tired and let him rest. It's good to let him rest, right?
I mean, he was sleeping and Dad brought him in, and your dad smelled like a brewery.
He sure did.
He's napping in the other room.
Yeah, so we diagnosed him
The
with
doctor went by bicarb.
Yeah.
But like we didn't get around to hanging it, so I thought that maybe you could take it. It just came up from the pharmacy.
Yeah.
We figured that you could just take it with you and start it.
Yeah, they diagnosed him with new DKA. I said that right?
Yes.
DKA.
We're gonna have to look that up because
Yeah, I mean we can talk about it later. That's what our preceptor is supposed to do.
I'm aware of what a preceptor
Okay,
is.
well,
I mean,
you might need some HR training as well.
I've been a nurse for I don't know how long.
Here. Sorry, guys.
Sorry, guys.
I got it. It's okay.
My bad.
Oh, what are we talking about?
Yeah.
Free?
Yep.
And
Yeah,
then
so-
that's just for the number, and then this is for.
He really needs to go.
Yeah.
Poor kid. Johnny.
He's been sleeping though for us.
Yeah, that's good.
Oh, here's
Yeah.
Here's
I'm Dr. Holiday.
Hi.
That means
Hi, Dr.
vacation.
Holiday. I understand.
So this kid's been real sick.
Yeah, I see
Real
that.
sick. He had glucose at 800. That's a peach of a hand. So
Oh, what?
a peach of a hand, a real high glucose.
Tombstone.
And so he had some insulin.
Yes, 8 units.
Yeah,
8
8
units.
insulin, and now his glucose is
250.
250.
He's at 250, so it's still high. You think we should get
And
some
it's
more?
I mean,
No,
Insulin too.
no, not right now.
Potassium
Do they
is
give you
pretty
the
much
bicarb
down.
drip?
Yeah.
Okay, so
because I'm your
you
Huckleberry.
He is not talking
that
to us.
you are.
No, we just been letting him sleep,
But
like
if
you
you
said,
get that together, maybe
Doesn't
they
have
want
any
you to hang that.
allergies.
Okay,
Doesn't have
so-
any medical history. Yep.
Yeah, so I mean, he is DKA, but he could be that hyper honk. That. So he could be that, but not really sure.
Yeah.
It's
He's
a
not
possibility.
a really good doctor. I'm just gonna warn you right now. So
Listen, Nurse Maddie,
Listen,
if you
Nurse
lay off the
Maddie-
laudanum,
I do have a bit of a headache.
yeah.
I heard something. What?
I
That was me.
hear all
I
sorts of
think that
things,
she's
but
got-
that's
She's
different.
got some problems. I
So,
don't know that
What
she
kind of
is.
access does
I mean,
he have? Though?
He's got a
Seriously.
bilateral.
So we got
IVs
access
here.
to
She
him.
is not
Yep.
begun to
No,
defile
we just have the one over
Just the one.
here.
Let's
Yeah.
start another one.
Yeah.
Okay.
So, I mean, did you guys string up the bicarb or did they
Well,
not
I
want
got
you
the
to do
bicarb.
it?
They were going to take it with them, I think. You want me to hang this?
Maybe we can give some
I
like
can
PO
start it.
We'll check it.
potassium.
Was this potassium low? I didn't
This is
see it.
3.5. You want me to get the
Okay,
PO
so-
stuff out?
With this potassium low, like we can give like 20 PO.
Okay,
My
let me
blood
see if
set
I can
or
go.
my
Let me go see if I can go
oxygen
find some.
saturation's going up
Yeah.
higher.
And so, I mean, I know you boys got to keep moving, but he
You're gonna
looks
get that
pretty
potassium?
sick.
Yeah, I got it in my hand
So-
here.
Okay.
I mean, whatever we can do to help you get out of here, however, whatever
Oh,
way that
great.
is.
Yeah.
Do you have it or you
But
don't?
he's pretty sick. I think we should get him moving.
Yeah.
I
But
thought, okay.
I mean, these nurses, they're not always super helpful, but they can get you some things.
We're helpful.
Oh. Well,
Yeah.
sometimes.
We're
Outside of
helpful.
here.
You got to get it
That
on in the back
outfit's definitely
storeroom.
helpful.
What is
Um,
maybe give him
oh.
the PO
Mine is
potassium
not.
in his nose.
I don't
Wow.
know.
Like,
I don't know what the hell
is your
she's
liver
Hey,
wearing.
it's
okay?
Harvey. No.
Are you sure you're off ascites? Because I can help you.
We can go to the store later and get you one of these if you prefer.
I mean,
Nope. All right. Just
Get-
I'm
drop
getting
it.
it.
What?
His outfit,
Oh.
his uniform.
I do need that outfit.
Yeah,
That's
drop
the
it.
thing she's only
How
got
much
going
epi you
on.
want?
So,
because she's got
poor
her
Johnny.
personality is not
I gotta
good.
figure out where I put it.
poor Johnny.
HR training.
He's-
I
HR
don't
training.
really
He's
know
super
about
sick
her
and needs to
nursing
get
skills
moving.
either.
Well, they'd be better if you would orientate
Can I
me.
move this?
Sure, if you want to move it, we'll let you.
Hey Matt, are you
Why,
a
Johnny
paramedic?
Ringo?
I
You
am.
look
Ooh,
like
I
you
like
are
paramedics.
Do
You want
you?
a date later maybe?
I like nurses.
Ooh, alright.
Okay, well,
Oh,
who doesn't around here?
I got excited
she
quick.
can go with
Yeah.
them.
You want a PBR later?
Maybe you could fly along with them. They might need an extra set of hands.
Hands.
Hands. Honk honk. So, you might be able to help them out.
Maybe you should go with them. I said they might need a
Did
doctor.
you get that potassium?
I did. I have it here in my hand.
Oh, okay.
You want me to put it in his
give
mouth?
Yeah, go ahead and give it to him.
Alright.
Oh, don't put anything in his mouth.
Are you sure?
Oh,
Yes,
Really?
please don't.
Okay,
well, his
okay.
potassium's low.
Okay.
But
Free
how are we going to get
oxygen
his potassium up there? Do you guys have some potassium you can give him?
Yeah, we'll give it to him on the way.
Okay,
Non-vibrator.
you can get
on the way?
the potassium.
Okay.
Get that potassium.
Well,
Yeah, we
Can I
have
get
a
a
pharmacy.
entitled
Why don't you
CO2?
get that
I
potassium?
mean, they
Entitled
still
to
have
have one in
video
your bag?
games
I'll
most of
find
the
it
night,
for you.
but
Yeah,
we
one
can
in
get
your bag.
1 ml
potassium.
syringe.
Why don't you get the potassium?
Okay,
It
I
should
would-
be on the
okay.
thing. I put the, remember?
So he's at entitled.
Oh, that sounds like
You
vomit.
better check on Dad.
I don't
Better
do
check on
vomit.
Dad.
I don't do vomit.
Oh, really?
Oh, Dr. Holiday.
It's in
Oh,
the,
I'll send the
Oh,
North
yeah.
bag. What do
I
you
don't
need?
do vomit.
it's in the North
Oh,
I
Wyatt.
think that's urine.
No,
I put it in there. He's throwing a guys.
Recognize him?
Oh, I didn't
It's
Johnny does not look good.
Speaking of people
Let me get his potassium out.
So,
You guys want this
Dad's pretty sick
potassium?
over here, guys. He's thrown up. He doesn't look good.
I wanted to ask that.
Yeah,
Okay.
he's real sick.
Dad's not.
Is this
I mean,
Dad?
he has a
Is this Dad?
problem. Yeah, this is Dad Wyatt. He's, somebody should take that beer from him. I don't think he should keep drinking it. But this is Wyatt, and he's
How many
had
kilos
problems
was it?
before
20.
in the
Oh,
past.
I need to sip
But we
this.
know it real good.
Listen,
I mean, you shouldn't drink that with your lockdown.
It'll just make it a better night.
with me.
all of
Over
us.
here, he's pretty
What?
sick.
Two ml.
And he's
Yeah,
kind
and
of
I
wild.
just-
I put the potassium up here for you guys.
He's bigger. Hey, thanks. Did you start it?
Do you want me to?
No, I don't.
So-
Okay.
Thank you.
What do you
Okay.
guys think over here? Like,
Can we get
he's
an
pretty
ice stat?
sick.
Yeah, you can get it iced
Can I
out.
draw an ice?
He's pretty
It'll be
sick.
here. You guys will have it in 2 minutes.
Okay.
Yeah, he's pretty sick over here,
My
guys.
oxygen
He's
is not
thrown up
increasing.
on himself. Looks
It
like
might be
he's
on
on
15 later.
for breakfast.
It's not increasing.
We're
giving-
He was here the whole time.
I don't know.
One,
Yeah,
two.
guys, do you guys have anything that can
We just
help
gave a push
him
to
over
special.
there?
You wanna go?
Because he's
I'll
pretty
go.
You
sick.
should bring him over here.
I mean, I
Oh,
guess
I can
we
go
can
over
just
there.
bring him. We'll
Don't
just
leave the
bring him
kid.
to
I know.
you.
Got it?
Don't leave
Got
the
it?
kid.
Wyatt.
Okay, you're
We'll
good.
just take
Alright.
you over here. Here.
What is this?
Well, help you
Oh,
out.
God, here comes Dad.
Okay, this is
Like,
Wyatt.
He's just
So
not.
Wyatt, he's barfed a few times.
Hey.
He's had a little bit of alcohol.
You know
Oh.
that right
He says, "Oh,
I
we're
I
good."
don't know.
He looks like a
They took
flu
my
patient.
beer.
Well,
Call PD and take that guy away.
I mean,
now?
he does not have an IV yet.
Yeah,
If you want to
well-
start one, like you can start
Did
one.
Joe start that one?
No,
No,
that's
no,
he
no.
doesn't have one
Don't
until you put
verbalize
one
it.
in.
Whatever.
Okay, do you need help? I mean, it's my second day, but I can do
Absolutely.
some
Absolutely.
things.
Could you
I can
Like,
bring him.
Yeah,
you want her to
over
stick
here.
him?
I can
Yeah,
bring
go
him
for
in.
it.
I don't know that she can stick
We're gonna
him,
get
but
to some food.
Okay.
Hey, you took
About
my
how
beer.
fast?
Listen,
Yeah,
man,
he
I'm
really
not-
does.
Okay,
He
20
usually
times a
does
minute.
like her.
Okay.
Hey, do you need help over there, Durst?
I might.
Or Maddie?
I mean, Matt's in charge, but he might.
Somebody should be in charge.
I know.
Here.
Not
That
us.
sure as heck ain't.
Okay,
I mean, I've
okay,
tried,
here.
but
Put a big one in
I-
there.
Oh, good.
How's that
He
patient
likes a
doing
big
over
one.
He
there?
doesn't look too good, to be honest.
Do you smell that,
I like
Maddie?
big beers,
Smells like
and I
death.
cannot lie.
Yeah.
Yeah. Who doesn't like a big beer?
Yeah.
I mean,
Okay,
come on.
and put them, put
We
them,
couldn't-
Crazy.
Yes,
Don't-
Stretcher,
don't
we
give me-
need to
We
keep
don't-
Yeah.
This is a small
Okay.
hospital, ma'am. Very small.
Okay.
This is the whole
You're
Hey,
staff.
right,
can I have my
Ethan.
hat
Yeah.
back?
This is the whole staff.
Okay, alright, well,
Well,
we're
So-
gonna put him
down.
in a
He's not
Wait.
normally, he's
In-
not normally like
in the
this
spot.
when he's drinking.
Yeah, they're no
Okay.
problem.
there we go.
Looks like he's doing the drunk do-si-do.
There we go.
So we got a good one over here. Wyatt, what, do you want us to give something? We could give him something
Yeah,
for it.
let's give it
I think
a
somewhere
What
I watch his
What do
head.
you want us to give? Tell me and I'll order it.
Ativan.
Oh, you got
Ativan.
Ativan?
So how about we give him 10 of Ativan?
Okay.
You got 10 of Ativan?
Right there. 10. No,
Yeah,
give it 2.
that'll stop the seizures.
It'll stop a lot of things. How about we just do 2?
Well, you just want
That's a
2?
medicine.
Yep.
That's not my
Okay.
first time bagging somebody.
In the red bag.
Well, I don't.
Yeah.
We love you doing very
Red
good.
bag.
Thanks.
Red
Oh,
bag.
narcotics.
Oh, those are our
Those are the
favorites.
narcs.
This
There's a
hospital,
lot
we
of
give a lot of
narcotics.
narcotics.
So my oxygen
Look
is not
at him, he's over here like a break
Why
dancer.
don't you get that out of near him?
He's
How about you get
he's a
C.
drunk
He's a
Thanks
break
for the
dancer
title.
over here.
Respirations are 10.
So,
What if I put him face down?
I sure do smell
no
that
blood
though.
pressure.
But
Thank you.
What?
Give me both.
this guy, he is
What are
a
you
twitching,
giving?
Give me that 3.
twitching real good.
What?
I mean,
Stop
do you
it.
need to order
Stop
something
it.
else for him?
What? Stop it.
Maybe, could you just jab him with that? Maybe
You just
that'll.
give it to me. I'll try to give it.
Hey,
Yeah, you
Hey,
give it to him.
Nurse
Uh-huh.
Val, he might need a full.
Maybe the other way around.
He might need a
Maddie,
full.
Maddie.
Outside the hospital, Val, we keep that amongst ourselves.
No, I've caught you guys. I've only been here for 2 days.
We try not to do it in the hospital. Come on, most of the time, unless it's not busy. There, you know, there's only 3 beds in the whole hospital. If we use one, what's it matter?
I got a flush. I
Okay.
flush it.
Oh, he's stopped.
I think
Wow, that's
Yeah,
a good
does he
earring.
breathe?
That's awesome.
I don't
Let's
know.
check it.
63.
He looks like he's breathing.
Behold,
Yeah, he's
pale
moving.
horse.
He's what?
I
Hi,
said, behold,
Wyatt.
the pale horse.
That
Can
is
you
right.
hear
He
me?
is a pale horse.
He is a
He's a horse. He's a pale horse. Look at him. So,
What do you got
what
there?
else do you want us to do
Right.
for you?
Rocks.
Yeah.
Yeah, Dr. Holiday calls that the rocks.
Rocky
The
Road.
rocks.
Oh, the rocks.
Oh,
Yeah,
the rocks.
I do like rocks. Bourbon on the rocks is real nice.
Bourbon on the rocks is great.
I'll take that.
The rocks.
Oh, he does not. I've heard those sounds, but never in the hospital.
Oh, yeah. Oh, yeah, there's one right over there.
Oh yeah, there's a monitor over there. I could have told you that.
Yeah, we do. We do have equipment
You
here.
can ask me for things. I'll help you. I promise.
I
mean,
we didn't have
Or
enough
I'll just tell the
stretcher.
nurse to do it. That's my favorite. Just tell the nurses to do it. It's bad.
I know.
It just happens.
Typical doctor.
Weird.
I tell them what to do at other places.
I'm sure you do.
Yeah, that you do. You're pretty bossy outside of this place.
Do you need help? Are you good?
You got the kid,
I
right?
hope he's not talking to
Mine's
me, but-
maintained.
I mean,
There we go.
we're gang.
There we go.
Woo!
Okay, what else do you,
All right,
do you need
Wyatt.
for him?
Where's the-
More insulin?
Rocks?
Rocks? Oh, rocks works. I mean,
Insulin?
he won't move.
My
We don't have
card?
to worry about him season.
Time!
Hi.
I didn't do anything.
I'm not getting up.
You're gonna
That's
have
just
to
way over the top.
Well,
The first time I got down there, my
okay.
That's a really good one. That's like
How do
the
you even score something
We did
like
that
that?
this morning.
remake that.
We did this morning.
It's like the second
With a can of beer
Yeah.
and some oatmeal.
I'll say I see the oatmeal.
Yep.
You talking about my white arms? Pale
There's other stuff right here.
Okay, thank you.
Gosh,
I'm Nurse Maddie. This is Nurse Val.
Coming.
guys.
Yeah, we've been trying to get him out for a couple hours now. So,
Well, we're here now.
okay, I'm so glad.
So can you tell us what's been going on?
Yeah, this is
You
Johnny.
give report.
Yeah, this is my second day. This is my preceptor, although she's not a very good one.
Well, I mean, look at how she's dressed.
This is an appropriate nursing uniform. So, this is Johnny. Johnny's 5 years old. His dad brought him in because he just hasn't been feeling well for the last 3 weeks at home.
Sure.
Okay.
Dad brought him in because he thought he had the flu. So some nausea, some vomiting, some new bedwetting. He's lost a little bit of weight recently.
Okay.
And our doctor, who's not very good, diagnosed him with DKA. Is that correct?
Yes, we'll have to talk about that later.
Okay, we
Sounds
will. You
good.
should teach me something later, maybe.
Yeah.
I'm
Somebody
not leaving
needs to
me
teach you something.
out here to dry.
Mm.
Yeah.
What's his name?
Johnny
Johnny.
Ringo.
Hey, Johnny, can
Yeah.
you hear me?
All right. Well, first of all, thank you guys. Have you guys gotten any labs on him? to
Yeah,
confirm
we
his DK?
did. So when we came in, we had initial blood sugar of 800,
Okay.
and an initial K of 5.5.
What did you do for that 800 of blood sugar?
We gave him 500 of saline, correct?
Yes.
And then a large bolus of insulin, like 8 units, right?
So
Yes.
8 units of insulin?
Yep,
Okay,
yep.
let's go ahead and get another sugar.
Yeah.
And then we just rechecked about 20 minutes ago. His K is 3.5.
Okay.
And
it
then his
was
blood sugar was,
5.5
yeah.
initially, but now it's 3.5.
and now his blood sugar is 250. That was 20 minutes ago.
Okay, great. So let's get one more sugar and let's go ahead and get some potassium going. Have you guys started any insulin yet?
No, we have. We just gave him a large bolus. Yeah.
Okay.
The doctor wanted the spike.
Yeah.
But I figured you guys were here and it just came from pharmacy. Maybe you could take it with you.
Yeah.
Okay, we're gonna set him up.
Unless you want me to start it.
Respiratory rate is
No, it's okay.
42. Hey Johnny, how you doing, bud?
Do you want to get the potassium?
The pharmacy.
Yeah, if you guys could get me 20 milliequivalents of potassium.
Sure. I'll be
And
back.
then I'm gonna go ahead and assist some ventilations. We're 88% and he seems pretty unresponsive.
But he's been sleeping because, you know, we've had a long night. So
Yeah.
What's my
he
blood
came
sugar?
in
I
with
just took
Dad.
it.
240.
Okay.
Dad smelled like a brewery, so Dad's sleeping it off in the next room.
Okay, I got the potassium.
All right, great. Let's if you just Yusuf, can you please check the potassium and see how many we need for a 20 kilogram patient? I'm gonna start BVMing our patient.
Our pharmacist made this, so not me.
Yeah.
Thank
I mean, they
God.
made this one too. So.
Yeah.
I'm gonna hook this up
We
to
don't have, we
oxygen.
have very limited, you know,
So it'll be
supplies down
10
here.
milliequivalents an hour.
Okay, so let's start with 10
Because our
milliequivalents an
potassium is
hour.
what?
Is 3.5.
Okay, good.
So he definitely needs
Yeah.
potassium before we can even think about giving more insulin.
Okay.
So let's do that. I'm also going to start BVMing. I have a PEEP valve at 5. This is going to be at 15.
Oh no,
Okay,
here
guys.
comes trouble.
Hi.
Here comes
I'm Dr.
trouble.
Holiday. That means
It's-
vacation.
It's
Uh-huh.
very
So,
nice to meet you.
This guy's really sick. So he had blood sugar of 800.
Thank you.
That's a peach of a hand.
Okay.
And so
Let's get some
he's
fluids.
had some insulin. Maybe he needs some more.
Okay.
You know, he's DKA, but he could be that hyper, honk. So he could be that. But how did they given any meds since they've been here?
They've just
yet?
kind of been jacking around.
I
Oh.
told him that they could.
Well,
they
maybe
could
we
get
should
the
get on
bicarb.
it and do some sodium bicarb or something,
Well, I
or
haven't. I
maybe
told
some
they said they
potassium
didn't want
Well,
it.
they asked for potassium.
Oh,
They
okay.
did,
Okay.
yeah, yeah.
This stuff
okay.
up.
So we
Okay.
just haven't given any potassium
So
yet.
let's
Not
go
yet.
I mean, we
no.
could give like 20 of it if you
Entitled
want
is
to.
on.
Well,
You
You
guys
guys
can
want me to go
start
get some
entitled.
PO?
Yeah, you can give him 20 PO.
Okay, let me go
No,
find
let's-
some.
we can do 20 IV.
Oh,
So we're
okay.
going to do 20 milliequivalents, 10 milliequivalents an hour of potassium.
Oh,
We're also
okay. You
going to
just
hurry up
want
and
it
get some fluids on
one
board.
time.
Have you
Okay.
guys given any fluids?
500.
I got
Right.
500.
Okay,
Yeah.
any other than
Uh,
that?
No,
I mean,
we just didn't
I
let
can
him
order
sleep.
some more if you
He
want to
was
order
sleeping.
him some more IV fluids.
So
I mean,
I'm
he's got
bagging
that
and
sodium
I'm keeping
bicarb
chest
going.
rise. His end tidal looks good at
So-
44.
Okay, anything on the
so-
oxygenation?
Yeah, so we have this connected
I know
to
you
high
boys
flow
got to
oxygen.
keep moving, but he looks really sick.
Okay, does he
He
take
does
any
look sick, and
medication
I don't know
every
very
day?
much. No,
Any
no,
medication?
no
No.
medicine.
Is there
No,
any
it's-
chance that he could have gotten into anything?
I don't think so.
He got into some pee
Yeah.
apparently.
So
No.
where's
Right.
family? Where's parents?
He's
So Dad's
sleeping.
sleeping
He
it
came in
off.
smelling like a bar.
We know him.
Yeah.
He's been around a
Okay.
few
We
times.
could go
but-
get
We're
him
gonna
if
do,
you
he's
want.
starting to become
Yeah.
bradycardic, so
Yeah, I
let's
know.
go ahead, you're bagging.
Okay.
Yeah.
Oh, so his heart
So you wanna
rate's
do a
dropping.
That's not looking
Let's go push
good.
those
So
up
we
your
should
Yeah.
get something.
Do you think
I mean,
maybe
hey,
you
do you
should?
smell that?
Do you
It
maybe-
smells like death.
It does. Do you
Yeah.
think maybe you should fly along?
That's a great idea. What do you guys think?
Yeah, we'll
about
talk about that
just-
later, okay?
Oh, like, cause I'd be a great help. I
Yeah,
think.
sure thing.
I've always.
You've always wanted to go for a helicopter
Yeah,
ride.
That's
All right,
right.
hey, Yusef,
Yeah.
You could.
Kubar,
you
what do
could
you think?
have that
I
out.
think push dose epi because his heart rate's coming down. Let's get an
You are
epi
my
infusion
huckleberry.
going.
You.
Okay.
That is true.
Absolutely.
Huckleberry.
So we're gonna do
Yeah.
2 mils
This one over here.
So-
man.
of epic.
Why, Johnny Ringo, you look
You
like
two are the
someone
ones
just walked
that I
across
just caught you
your
guys
grave.
in the back supply room, so enough. It's
I-
inappropriate for
Just one
workplace.
time, and we usually keep it out of
Look
here.
at her,
Alright.
Miss
So just
Nurse
leave it alone,
Judy
Nurse
over
Maddie,
here.
and
It's
take some of
Maddie.
your
It's
lungs.
Maddie.
Push those epi
Take
will
some
hold
water.
I do have a bit of a headache. I can
What
go
do
for
we
some
need to
right
I bet
now.
you do have a
I think
headache.
it's
Yeah.
You're
exactly
giving
Yeah.
me
Push
one.
dose epi
They
and
might.
infusion.
They might.
Yeah, you're giving me a headache, but
Yeah,
I
we'll
think
hang
we
the
should
epi
probably get
at
him
2
going.
bites a
Don't
day.
I
you?
do. He does not look good.
Just hanging out here isn't going to fix it. We
Yeah.
need to pick you.
Alright,
This
thank you.
hospital
We're
has
gonna do
limited
push
services.
dose
We don't
epi.
have.
Pick
He
you.
could pick me,
What I
but
feel.
he needs to
Thinking
pick
of, so I'm
you.
gonna do
He
So-
does, and then he doesn't get
Somebody
taken
will
pills.
pick
We
you
can
in
get
that
him out of
push
here
dose
epi.
and get him to. I mean, it probably needs a
Are you a
pediatrician.
paramedic?
Yes.
So-
Ooh, I like medics.
I bet
Can
she
you give me a
does.
date
She's
later?
been on all sorts
Okay,
of medics.
and we are
She
going
makes
to
comments
do.
about
Yes.
Alright, so we're giving
she
push
was
dose
upset.
epinephrine for the
She
bradycardia.
Good.
Oh wait,
Let's
we're giving
think so.
epi on this patient.
We sure
Oh goodness.
are.
You think he's that sick?
Well,
Yeah.
yeah,
I
he
mean,
doesn't
he
look
looks like
good.
death, but
Maybe we
good.
should go get Dad.
He doesn't look
you wanna go
good.
get
Yeah, we
Dad?
could be
Since they're
Dad.
gonna
Alright,
like
so
they're
we gave
bagging
some
him,
push
you
dose
probably
epi. Let's
should
do
get
an
Dad
epi drip.
and
Yeah.
see.
Are you
know,
okay with the 1 per kilo?
You know, if
Are
they
you only
want.
0.5 per kilo?
Oh,
It doesn't
you
look
know,
good.
I think 1 per kilo
Alright, hey,
sounds
Yusef,
good.
can
What
you
do
make
you
sure that
know?
you're
What
bagging-
should you have done?
I'm a doctor.
to prevent
Yeah.
this?
Is he a Jesus? Is he waking up at all?
Is he Jesus?
Holy Ghost
Jesus.
Hospital.
No, he's not waking up. We just been letting him sleep, you know, because
Yeah,
he's had a
he's
long
been
night.
so
here.
tired. He's
You
been
wanna-
working
yeah.
hard.
He's been
Keep back.
Yeah,
Yeah.
he's been
Oh,
through a lot.
vomit! I hate
You wanna
vomit.
get Dad?
Dad.
Get
Vomit.
bring Dad in
That-
here
oh,
since he's
vomit.
sick.
I
Yeah,
want you to
we
make
need
sure you're
to-
getting
oh,
chest
Don't
on.
get that on your uniform.
Oh,
Don't get that on your
Heart rate's back
uniform.
down, so we responded to that push dose of epi. Let's get that infusion.
Hey,
It
you
looks a
guys.
little better,
Hey,
but
the patient's dad looks really
Hey,
sick.
found this. I might need
Dad
some
is
now.
throwing up over here.
Good bilateral
The
right
patient's dad is throwing up over here, and he does
Okay,
not look
he
good.
needs an
empty.
So, you think, well, yeah,
So
'cause
get
he
someone to
drank
bag for you,
Oh,
and I'll
okay.
get the epi.
Hey, student
Get
nurse.
someone help me.
Okay.
Quiet.
Well, I'm not a student nurse. I have my degree, but
Come here,
okay.
start bagging for me.
Okay, well, how fast?
Just like I'm doing
So,
here.
I
So
mean,
every
he
3
is
or
a
4
little
seconds.
Okay.
Just a little drink of
Okay.
once in a while.
I learned how to count
Yeah,
nurse in
great.
school.
Excellent.
He's
Thank you
a
so
little
much.
bit
You're welcome.
for us, like he just looks, he's vomited, and he's been around a few times.
Been around with you two.
So, I mean, look at his vomit on his chest.
Okay. Hey, Yusef, you good?
Yeah, I'm
Vomit
starting to
bad.
drip. His heart rate's coming back down.
He's not good.
Hey, Yusef, you want to trade or are you okay?
No, I'm okay. I'm gonna
Is
start this epi
everybody
drip right
good?
now.
Alright.
I'm not good.
I'm pretty good today.
Oh.
Okay.
We'll get him.
Here, we'll drag
Doing
him.
good bagging.
Thank you.
We've dragged him around already.
Now,
It's my first time bagging somebody besides the ECLS class.
Oh.
we're gonna lay him on his side. in case
I'm
he-
glad I can be useful.
There you go. Let's see.
Ooh, look good over there.
Oh, she's so pleasant. She's like giving him a
That's nice. That's nice.
Let me get his blood sugar.
I don't know if I would give him a pillow.
Okay, you can check his
I'm gonna
blood
check
sugar.
Let me just get his sugar. Yusef, you good?
Yep, I'm starting my epi drip.
Let's
You
check
know
your
the
blood
code
sugar real
Yeah.
quick.
You gonna poke him? Do you have his glucometer?
Oh, Brian, Dr. Holiday likes to get
Okay,
poked
so I'm
too.
starting an epi drip right now. My epi drip is going to start at 2 mics a minute.
Oh, good for you. Good for you.
Okay.
Oh, okay. So now he's doing
Epi.
Epi's in.
Epi. Epi.
Sir, what I'm gonna have you do is I hope you have a
Well, poor Johnny.
I want you
Strong radio pulse. We'll see how he responds to this
just
epi
go to sleep.
infusion.
Nice. I need
Poor
one.
Johnny.
Sir, you can go on vacation. Thank you. Ma'am,
Oh, God.
Can you
My
please
name just
watch
means
him?
vacation.
Well, she thinks you're on vacation.
Holiday is vacation.
His SpO2 is a little low.
Ooh, Johnny. This is the sickest kid I've ever seen.
Do you need help in here, Maddie?
Maybe. I don't know.
I don't think you know
So our
what
epi
you're doing
infusion
either.
has started, okay?
Listen,
I have been going at
he
2
said
mics a
I'm
minute.
doing a good job bagging.
You need to get him intubated.
2 days on the job.
just
It's
throw
gonna
it-
squeak your back.
I learned this in ACLS. I learned this in ACLS. I do a better job than you can.
I can't believe they let you take ACLS. You can barely spell it.
A.
Oh,
Oh no!
he's doing the drums, DMC no.
Oh
Protect his head.
Protect his head.
no! Oh no!
Protect his head.
I am.
It's getting noisy over there.
Well, he's over here doing the drunk dosey do and breakdancing.
Ooh!
Yeah.
Not good.
He's pretty sick.
He does look
You want
sick.
some meds?
No, I already got him.
What
Thank
meds
you.
you
I'm
gonna
gonna
get?
get 4 milligrams of Ativan.
I'm
He
taking
looks
like 10.
terrible.
What about 10 milligrams of Ativan?
Alright, I have given him Ativan. Siri, I hear you talking. Shut up.
I think 10 is great.
10.
Alright, no,
Yeah,
it's
he'd
updated
sleep and stop this nonsense.
He would. He'd go to sleep. That's for sure.
Stop this. Okay.
Wish I was asleep.
I got it.
Oh, okay. We don't want
So-
it. I get it now.
Things haven't really changed since we began.
Ativan works good.
Yeah, that's your call, not mine.
Yeah,
Stop
so-
breathing. We're gonna get it back.
I'm just
Considering
saying,
how
Dave.
long this drip and-
Hey, where's the Hamilton?
Where's the what?
Where's the Hamilton?
The Hamilton ventilator?
I think we should have listened to the doctor in the
I
room.
think he's breathing.
Turn him on his side. Turn him on his side.
Move this
Turn him on his
up.
side.
Turn him on his
Okay.
side.
Ooh, they know about that.
Let's turn him on
So,
his side.
we're gonna assess his response to this. His GCS is still 3.
Yeah, he's just really
He's really
sleepy.
out of it.
Yeah.
Okay, so we're gonna go ahead and secure this airway.
Okay.
See how he does. We have our
Okay.
epi drip going. I'm probably gonna bring the epi drip
No, he
up
doesn't have to be
to,
intubated to back
actually I'm just
him
gonna leave
if
it the way
he
it's at.
wants.
We're doing
Use the ventilator.
alright. I'm
Do I
gonna
need to stop
position him
doing
properly. No, you're good the way you
Okay,
are.
we can use this. I just need a bag.
I need to have my suction
use
ready.
that
Oh, I can use
Here's the
suction.
bag.
I can suck real good.
Okay.
Thank you very much.
There you go.
It's not gonna help me.
Suction is ready.
You said give her a bag.
Do I actually have to?
Okay,
You sound like
we're
it's sucking not good, actually.
Oh, he's sounding at 86, 87%.
So,
I'm gonna go ahead and insert this.
Okay.
I don't know.
Okay, they're inserting something over here.
We're what?
Inserting something.
I bet you
Wait,
have.
Lisa, do you have the adult,
Adult what?
the adult mask?
What do we do
No,
with that? Do you need something for my help over
He's
here?
not vomiting
I
out
feel
here.
like
All right,
nobody
I'm gonna
wants
have
me
you
to help
away.
them do anything.
Okay. Yeah.
Go ahead
Hey,
and clear out the
Dr.
way.
Holiday, I need an adult
Okay, I
mask.
A mask.
gotten out some
Like
secretions.
Phantom
A little
Opera
bit,
mask?
yeah.
Good.
PPM
We
mask.
cleared the airway
Okay,
immediately.
where would I find it? Because
Well, he
I'm
has
a
a camera
doctor.
request, so
I
you
don't
can
know
take
where
his
we
out.
keep
Yeah.
supplies.
All right.
Sorry, I'm going crazy, but I can't.
Okay, we're gonna go back to back.
Okay.
I don't know where I keep
Okay.
supplies.
No, you're good. Okay.
Uh,
Anything up at all?
She's brand new. It's like her
So he didn't want to take the
second
key.
girl.
which is
I know,
all
it's
right.
good.
He's breathing and moving.
Breathing and moving. Breathing and moving. Not him.
He's
Him.
okay. He's just sleeping it off.
I'm gonna be feeling for breathing.
That's what you do in the back room all night. Sleeping it off. Sleeping it off.
Okay, he is breathing. We're gonna continue.
You know that.
Sleeping it off.
Yeah.
Hey, Jess.
that's all he's
Yeah.
doing.
Yeah. That's what all
Wanna
you do.
trade?
Sleeping it off.
I mean,
Let's trade.
just
Sleeping it off.
Sleeping
Oh.
it off. He needs oxygen.
Yes, so we
Now
went to
you're
go
saying-
pick the and start vomiting.
I'm sleeping it off.
To maintain heal with him.
Okay,
Alright.
so we're gonna have to
So we got
RSI this
nothing.
kid.
Sleeping it off.
Okay,
Just-
so
I
we
think
have
he's
done
fine.
nothing. We have a sugar, we have K running, we need fluids running. Let's say we give him 400 of fluids, which is a full bolus. Let's see.
I don't know. Something.
Alright.
Sleeping it off. Sleeping it off.
Let's increase our peak to better oxygenation.
Okay.
Thank you. And then this didn't work. He is hypertensive.
Hey, that Yusuf guy, he's gonna be my date later. I've got 2 now. Good job, guys.
You don't want my lipstick and my chapstick and everything else?
Oh crap! I just stepped on atropine.
Oh boy. Okay. I think of some good things today while we're waiting.
Please.
Oh. Oh.
Oh, I got like a list.
Oh, yeah.
So good. So good.
Thank God they're almost here.
I know.
I heard that helicopter.
Oh.
Hi guys.
Hey.
I'm Nurse
Hey,
Maddie.
Nurse
This is Nurse Val.
Hi, I'm
How are you guys?
William, this is Dusty.
Nice to meet you.
Alright.
Thank God you're here. Been waiting forever. We're trying to get him out for
Yeah, sorry about the
hours.
weather.
I've been
We're
orienting
here.
Yeah.
Val here, so I'm gonna let her give you reports.
Yeah, she's a horrible preceptor, so I'll do my best. Okay.
I mean,
awesome.
look at how she's dressed.
This is an appropriate nursing uniform.
It's-
Yeah.
Okay.
So this is Johnny. Johnny Ringo. Johnny's
He has not yet
5.
begun to defile
His dad brought him in a couple hours ago because he's just been sick for the last 3 weeks at home.
Capnography on talking
Just
to
like
her.
flu-like symptoms, right?
Yeah.
Nausea,
Last couple
vomiting,
days. Yeah.
just feeling tired, lost some weight, and then a little bit of bedwetting, right? Yeah.
Okay.
Yep,
So just to recap, so bedwetting, nausea, vomiting,
Mm-hmm.
not feeling well.
that's correct. 3 weeks.
Did you guys manage to get any sort of sugar on him?
We did.
Yeah, we did.
Yeah, we did.
Let's get a full set of labs.
So
too.
when he first came in, his blood sugar was 800,
Okay.
and his K was 5.5, right?
Yes.
And then we rechecked it, and his K was 3.5, and his blood sugar was 250, like 20 minutes ago.
So that was like 4 hours ago.
Yeah.
This was like 20 minutes ago they resulted.
Yeah,
Okay.
we've given
Yeah.
500 of saline, right?
Yes.
And then
What did you do for sugar?
a big bolus of insulin. We gave 8 units, right?
8
Yes.
units
Yeah.
of insulin. What time was that?
Were you
About
gonna say?
20 minutes ago.
Have
Yeah.
you checked
Getting
the
on the-
sugar since you guys have given
Sure,
that insulin?
sure. Well, it was 250 about 20 minutes ago.
Let's go and recheck
Yeah.
it now. If you can grab
Okay.
the glucometer for
Oh,
me.
sure. Okay.
What
We
access
can do
we
that.
have?
I don't know.
Just to recap here on him, do we have
Where'd you do
2
with the
working
You have one
Sure.
IV over here.
One IV. So this is not an
Oh, here
working
it
IV.
is.
Let's go
Okay.
ahead
Oh, yeah.
and flush that.
I need.
Glucometer.
You check his blood sugar.
Okay.
I've got clear breath sounds. Airways this. What is my mentation? Is he talking
He's been
to me?
He's been sleeping.
Yeah.
Sleeping?
He
Okay.
Yeah.
was, he was awake when he came in, but
I
then we
want-
just thought he could sleep.
I want
Yeah.
a nasal cannula
I mean,
with
we've been waiting a
end-tidal
long time,
capnography.
so
Yeah,
yeah.
and
So-
Your blood
Dad-
sugar is
Dad
240.
came in
Blood
with him, but
sugar's
he smelled like a
240.
brewery, so
Pause. I'm going to
he's
start another
sleeping.
IV here.
Okay.
Okay. I have a bicarb that's running through this.
Yeah, our doctor wanted that.
Okay. Is this actually running? It just looks like it's hanging.
well,
here.
it just came, so we
Yeah.
figured that you could take it to him.
Okay.
You could
Okay.
take it with you when on
So
flight.
let's pause.
Yep.
I'm going to go ahead and start another IV. I'm going to get some fluids running on him if you want to work on the ABCs and the
Okay.
full assessment. You guys
Poor
are going to
Johnny.
go ahead
I know.
and get did
Poor
we get
Johnny.
that second blood sugar on him?
Yeah, it was
Oh,
240.
240.
Yeah.
Great.
Yeah.
So I'm going to work on that while you work
I
on
learned that
the
my first day how to do a blood sugar.
I know.
That's the one thing
Awesome.
she's taught me. That's about it.
See, at least she's saying I did something.
Yeah, you need to
I
go
don't
to
think she's
preceptor
gonna
training.
make it.
All right, I'm going to go ahead and
And
maybe
put
some
my
HR
PPE
training.
on here. Do you have all of
HR
your
training.
appropriate
Yeah,
PPE?
PPE is on. We got
HR.
all
I need to
that.
learn how to dress appropriately.
This is an appropriate use nursing uniform. I think we should get you one maybe after work.
Awesome.
Yeah.
Hey, can
Right.
I'll let you pick it out.
Okay. Maybe we can get a beer afterwards.
Hey guys,
Yeah, we probably
Hey.
should.
I'm
Yeah.
Dr. Holiday. That
What's
means
up?
vacation.
awesome.
So this guy here, he's been super sick. This little guy, his blood sugar was 800. That's a peach of a hand.
yes,
And
sir.
so this guy, he's been real sick. Now he DKA, but he might be that like
entitled CO2.
hyper something,
Okay.
honk,
Honk!
you know, honk. And
Alright.
so
Oxygen
it could be
on the
that.
wall.
I'm going to go
Okay.
ahead and just stop you for just
Okay.
1 second.
Oh.
So
He
we're
doesn't
all
like to
doing
stop.
this
He doesn't like to stop.
Let's like
You're
it
gonna
going.
He likes
I
to
go.
keep going.
That's
Yep,
right.
so I'm
Yeah.
gonna work on that. I've got.
So,
I'm gonna put.
Did you guys get the sodium bicarbonate?
We got it here. We get. Yeah, it's
Okay.
here. It's here.
Have you started it yet?
Well, no, you might need to convince them.
Oh,
Yeah.
okay.
Yeah.
Well, I think he needs a sodium bicarb.
Well,
Okay.
I can
Did
hang
you do
that.
it?
It's right. It came from the pharmacy. They
Okay,
were
So
going to
let's
take
start.
it.
I'm gonna need you to
Okay,
plug this
did
to
you
oxygen for me.
check
Can you
his
plug that
glucose
at
again?
10?
We did.
What was his glucose?
240.
240. So
Yeah.
it's still high. Don't you think we should give some more insulin?
This is
We're
my
gonna
second.
pause
This is
on
my
the
second
insulin
day.
doc for
This is my
just a
second
minute.
day.
you don't want him to
I
have
know.
any
Can I?
insulin?
I'm going to go
No,
ahead
I
and
was
no.
start
gonna
in
order like
line.
10.
Actually started.
Okay, you can order it, but we're
So-
gonna hold off on giving it. But if you want to go ahead and put that order set in for me, and we will bring it with
There's
this
that.
in
Well, he'll
slide.
make us do it. So
There's
thanks.
how you
Thanks
can
for
go ahead
that.
and
Let's
10
pause
units of
for a
insulin.
second. So
I'm
Dusty,
your
I have the
Regular.
second line started.
Regular.
I'm going to go ahead and
I
start
get
the
it.
fluids.
Yeah.
that we
Oh,
have.
there's different
Okay.
kinds of insulin.
Start the fluids.
Oh
Alright.
yeah.
Yeah.
Is this line flowing?
DKA. I learned that today. He's in
All
DKA.
kinds of different
Okay, so
kinds of insulin.
Yeah. Can we talk about DKA? Will
Yeah.
you teach me?
Okay, so this
Yeah,
line
this-
is
I think
patent
maybe
on the
we'll do
left
that
side,
one
so
maybe.
we're gonna
Okay.
start with
Why?
airway.
So, I mean, I
This
know
is
you guys
a-
got to keep
This is supposed to be a
moving,
learning
but he looks
environment.
pretty sick.
Yep,
DKA.
so we're
Okay.
gonna get him out here. I
You know
really
what the
appreciate
words
you, Doc.
are?
Okay, so I got
So-
fluids running
Airway.
now.
What
Airway is
20
done.
This team
mils per
appreciates
kilo.
me.
They do.
So let's do
That's what he
a
said.
at 20 mils per
So,
kilo. Does that sound
Okay,
Sounds
so What about
And he
his
is
other
very
labs?
So
labs.
Are
our
you looking at his
Intel's
other
47
labs?
just for
His
that.
labs
That's
are up
too
here.
high.
Okay. Don't you think maybe we should
So
give
we're
him
gonna do
some
400
potassium?
mils.
Oh, I can go to the
400 mils,
pharmacy.
let's do
Okay, how about 20 of potassium PO?
Okay, let me go find
Yeah.
Hey,
that.
do y'all have IV potassium?
Ooh,
I-
I can ask the pharmacist.
I'll
Well,
say
you asked
Maddie,
your
maybe you
pharmacist.
can ask.
Yeah.
Here, I'm gonna clamp this off because it's leaking all over your bed.
Okay, so we're gonna do a 400 ml food.
Okay,
Oh,
pharmacist
yeah,
has
she's
it.
real sick.
They have it, guys. They have
Ooh.
potassium. I'll hang it right
Johnny
here for you
Ringo,
guys.
you look like
Okay.
somebody has walked across your
You're
grave.
awesome. Thank you very
He's
much.
not looking
Yeah.
good, is
He
he?
does not look good. at
No,
all.
poor Johnny.
I think we should get him out of here, kids.
I think we're going to.
Poor
Okay.
Johnny.
Okay.
Hey, maybe Dr. Holiday can go with you guys. He's always
That's
wanted
a
to
good
ride a
idea.
helicopter.
Yeah, Jack Holiday.
Yeah,
I've been
Actually, why don't you go find my pilot and see if he's got weight for you? Do you want to go find
I
him?
mean,
He's
I-
right outside. You can go find
talking
him.
about my weight.
I
I
know.
think you're
I mean-
fine.
So pause for a
They-
second.
oh,
I know
have
you
a-
do. I know you do,
Alright,
Huckleberry.
I know, you guys have to get it on the
Yeah.
storeroom.
Is that
I
right?
know.
We keep it
So I'm
out of
assuming
here,
some
Maddie.
sort of
Like,
degree
I
of
taught you guys earlier
You're
today.
supposed to keep it out.
Let's raise the head of the bed.
So what
Let's
else do you
consider
think we should
maybe
do for him? I
3%
think we
on
should
Let's
give
do
him
a
something
3%.
else. Do you,
On
do you-
that.
do you smell that?
Yeah.
That's the smell of death.
So, and we have a sodium of
Yeah,
125.
that's
So
not
that would
what
look
125.
good.
Yeah.
I think the
So,
sodium
I think
bicarb
we
would be a good
probably-
infusion.
They were talking
for him.
about 3%. What's 3%?
Oh, 3%?
What's 3%? I don't know.
How about 1.8%?
1.8? Well, what's in that bag of saline?
So
How
give
much?
him half of it. That's 1.8%.
Oh,
right?
okay.
Just
Okay.
half of the 3%.
Okay.
Well,
So I don't know. Should
So
we
I'm
really
gonna
give
do an
that?
epi
I don't.
infusion then.
I don't know.
Yes.
And get that running.
Sodium
we're not
bicarb.
gonna
It has bicarb in it.
So
It does.
each dose epi-
That's
It
what
does.
it needs.
We
It's just
do
labs
dose
are all
epi.
wonky.
Yeah.
I think
What
we
is
should
our
get him out
Pharmacists,
of here.
yeah, they know what they're
Johnny
doing down there.
Ringo. Johnny Ringo.
Yeah, so-
Johnny's not looking good.
Yeah,
He's not
we're good.
breathing real good.
What's
What's
that mean?
when
What does it mean when it turns red like
No,
that?
let's just-
Trouble,
let's
go
danger,
ahead.
danger,
Pass it
danger,
I'm surprised you don't
Not that
know.
low
And then
danger,
Look at that.
danger.
Let's get the epi drip. I don't want to pull the trigger on
You
the
like
epi yet.
danger.
But let's have it out. We got push dose ready.
That is not
And then
wrong.
we
I'll
got
do
the
the
fluids
epi
going.
drip.
Okay, so we should.
Oh, where's she gonna
Yeah,
check
I'm
on
gonna
Hey,
Dad?
you should.
Yeah.
Since things
No,
over
I'm
here
gonna
not
go get
doing that,
Dad and get
you should go
Dad.
get Dad and see if he wants to talk.
Oh, vomit, man.
Oh,
Hey,
Jack
Dad,
Holiday, come on.
oh, wow.
I don't do vomit.
Dad is throwing up.
Yeah, Dad smelled like the bar when he came in.
Check on Dad.
He's into the beer again.
Yeah. We just been having Dad sleep it off.
He doesn't look good. He's throwing up on himself.
Ooh, beer.
Doesn't
got
look
you a
great.
beer.
This is Dad. This is
Oh,
Wyatt.
it's empty.
Wyatt,
Are we
come on,
dealing
honey,
with-
what's going on
Do you
with
guys have someone that can help Dad at the moment?
Yeah, you. That's what you're here for.
guys-
I don't.
So
I mean,
did
we
you-
could try, but
Did you get
it's not
some
like
400s running?
throwing up.
Right.
so is he still
You guys have the whole
400 is
seat
running.
on.
400
He's
is
still
running.
throwing up in here.
So
Do
400
you
is running.
think maybe we could help him with
3% you're
that?
drawing up.
I don't know.
So currently
I
I'm
feel
drawing
like-
up the epi
I
infusion.
mean,
At the infusion,
we
okay.
could
I'm
do all
going to
sorts
get
of
the
things.
3% going.
Yeah, I agreed.
Like
We
that.
could just like.
He is pre-oxygenating right now. We got good
He
respiration.
looks terrible.
We're gonna go ahead and get him
Poor
prepared.
Johnny.
to get ready
Johnny's
Well,
not
I mean,
looking
I guess-
good.
intubation.
We could just move him over
And
here.
then we'll go on
Oh,
with that.
just take
Okay.
it over there.
We get the potassium. I'll calculate the potassium for him.
Johnny's not looking good.
Look, we helped you. We brought
Ooh.
somebody over.
Oh, Dad.
So this is Wyatt. This is Johnny Ringo's
He's one
dad.
of our locals in town.
We'll be with you.
He's been around a time or two. We
We've
know
been around
Wyatt.
these two.
I just need a beer.
Yeah, well, no beer right now, Wyatt. I've never seen him this bad
And
before.
Tell him I'm coming.
I didn't think. I didn't
I'm
think
bringing hell with me.
Yeah, he's bringing hell
Okay.
on.
You hear me?
Look at it.
Hell's coming with me.
Poor Johnny. Maybe you guys need a stethoscope to listen to
I
it.
don't know if I mean.
You know how to
listen
use that?
him.
Alright.
I don't want
He's
that or
got-
anything.
Listen,
Yes,
I'm gonna
ma'am.
listen to you.
Yeah, that's Wyatt.
Anything about your son
Uh,
that might be helpful for us
He's not even sure he has a
I mean,
son. I
he's
don't think.
breathing.
It might be her kid.
He
We
should
never
be
know.
drinking beer. He'd probably feel better.
That
Okay.
actually,
Oh,
we should
I know.
share it.
Oh, okay,
We
thanks,
should
guys.
pass it around and everybody get
You
one.
guys do pass it around together.
Yeah.
Well,
Yeah.
talking. I'm not
I mean,
worried about
I mean,
this.
he's not usually
he's
this
so
bad.
big.
Beer.
He can
He's
party.
pretty
Let's just have
crazy right
suction
now.
out and think she does too.
So I have suction.
Can you get suction just in
Ooh, I
case he
sure
does?
can.
Thank you
We
very
took
much.
the bill, no
Oh,
beer
okay.
for you right now.
Suction, suction.
Oh, I bet you know about
And
that.
after we got your suction ready, can you just get me a set of bottles on Wild Bill in the floor? What
That's Wyatt. It's Wyatt.
Wild Wyatt. then.
Wild, wild.
Yeah, I think there's a
He's
monster for
wild in
him.
more ways
I
than
think
one.
there's a.
You have no
Why do you say
idea.
green? It's
He would
green.
show you though later if you
No,
want.
I need not. I need that.
What?
So he looks pretty sick. Look at that.
Oh, poor Wyatt.
Skin color.
Oh,
What did you want me to suck?
Hold a pale
Nope,
horse.
That is
Oh,
a
okay.
It's why it grows up.
yeah, that is a
Okay.
pale horse.
Okay.
I mean, there's a lot going on here, but
Oh,
he's
Wyatt.
sick. He looks pretty sick too.
He does.
Oh, he's over doing the drunk do-si-do.
Okay.
So,
Wyatt.
oh my goodness. You know, we should give him something for it. We could give him, what do you got in there? How about 10%?
Yeah, that sounds
He doesn't
10%?
have, doesn't have an
Getting
idea.
wild in here.
So, I mean, you can start an IV,
Does
right?
everyone
You still
Give me the
remember?
things.
I mean,
Yeah,
sometimes
sure.
I am
You still
10%.
remember?
Okay, I got it.
Oh, come on,
okay.
Johnny.
So,
Okay, baby.
yeah, like 10%. I think that's a good
Put
amount.
that doctor, can you hold this?
Oh, she's gonna
We're gonna
grow.
give it to
Wyatt's
you.
not
She's
looking
gonna-
good.
She's good.
I'd love to give him
She's
that.
good. You want to give 10%?
Did you guys finish
That'll help them.
Is this a working IV?
Yeah, I mean, she
So
pretends
I'm gonna
usually.
go ahead
If
and
not,
give
it goes in
5%.
one way or another, right?
Give him a shot.
Yeah,
Might
you
not
guys-
be in the vein.
You guys
You know.
spread it around.
We're-
Spread it
How's
around.
Johnny Ringo
I got
doing?
Johnny.
Oh,
Johnny's looking
I
bad.
smell death. I smell death.
Oh, Johnny.
Listen, you
Hold on, Johnny.
Yeah.
Hold on, Johnny.
Johnny Ringo.
Whoa,
Johnny
Johnny.
Ringo.
Johnny.
Johnny
So
Ringo.
we have 5.
Oh,
Johnny.
I smell death.
Hey.
Yes, yeah.
That was a
What does
lot.
that mean?
Oh,
That means not good.
we should probably check and see if he has a pulse.
Oh, that's, I don't know.
I think we should check. I mean, he peed himself, but we should
And you
check.
know-
Do we?
Well, only once in a while.
Maddie, I need you to go find the machine so I
I
can
don't
get
think he
his
has a
vital
pulse.
signs.
Okay.
Oh, I
think
think I know where that's
Okay.
Can
at.
you grab that
So,
for us? That's
we
We do
nice.
not. Hey, Jillian, pause. We have a cardiac arrest here, so I'm gonna have her start CPR for me.
Oh,
I would
okay.
hear you to do
Dying?
CPR. Actually,
I
I'll start
brought the monitor.
CPR.
I brought the
Okay, and then, I
monitor
mean,
for
2
you.
mils.
Okay, let's get a BPM
do
first.
CPR too, can't
I mean, it's possible.
You
It's,
can do
I mean,
CPR
usually
too.
I just let the nurses do it, but
you? I mean, you need some exercise, so.
I want you to
Not
watch
wrong.
me and do CPR. I want you to do full
Okay.
1/3 anterior, posterior chest depth. Start doing compressions for me,
Okay.
just
she,
like
like
that.
she's
Okay.
not get that.
100
She's had
beats
so
a
much
minute.
love,
Okay.
she doesn't know
I'm
what
gonna
that.
I'm
connect
gonna
this
sit
up
right
to
here.
15 liters.
You're just gonna
Okay.
sit down on the
You got
floor
that
and
going?
Maddie, are you okay over there?
I've got
Oh,
airway.
I'm doing
Look at your
CPR.
cross
What's
section.
going on?
Oh, yep, you better be
Yep.
careful.
Hey,
with
This is a
that.
busy second day.
So I am bagging with 10 of
And that
deep right
skirt,
now.
you're gonna
Do
get
I
us
have-
all the show in that
I just
CPR.
What do you
Okay, I got vital signs on him.
Okay, well
Okay.
here, let him see him.
Oh, here's his vital
Okay.
signs.
So,
Yeah, you have
Okay.
for vital signs
I mean,
for
he's
him.
over there.
There's like 119.
We are bagging.
Oh.
Hey, Doc, I need you to bag for me. while I'm doing
sure,
this.
121 over 70.
Can you bag? I want you to hold a great seal for me.
Okay.
Don't everything
He's a
else.
moonlight
I want you to
grocery store.
bag
I worked at the grocery store.
Oh,
once
bag.
every 8 seconds.
I have
Okay.
2 mils. That is about appropriate for his weight of 20 kilos.
Four,
This
five,
is 2 mils of 1 to
I think
10,000
it goes
epi.
like,
Okay.
that's
Do I
the pressure
need that?
bag. That's the pressure bag.
No, Maddie, you don't know what
I've
you're
got it
talking
right
about.
there.
Just
I've got
because you
blood.
took a class once doesn't
So,
mean you know anything.
At 1542, I'm giving 2 mils of 1 to
Okay,
10,000.
it's
It is
Ryan.
in.
Time.
How are you doing, Wyatt? We've got good vitals over
Time.
time.
You're good.
Well,
Sure. Go at it.
Okay, we're gonna put yourself in a box, guys.
Oh, you're good.
Is this theirs? Or
Yeah,
ours?
it's ours.
That's ours.
Yeah.